Hi guys, welcome back to this channel. I am so happy that you are here. Thank you so much for all of your comments on my previous video on diabetes. I have noted down all of your questions and I am working on the next video. But for today, I thought I will just have a very chill tea time conversation type of video because there's been a lot on my mind lately. And I also wanted to address one of the very common questions that I get on Instagram, which is about the reasons that I chose pathology for my specialization. So if you are interested to hear all of that, then stay tuned. Let's get started. So one of the first things that I want to talk about is where I am at in my career right now professionally, and how is that different from when I finished my MBBS. So to become a doctor in India, one has to go through medical college for 4.5 years and then 1 year of compulsory internship where we kind of rotate in all different medical and surgical specialities and work under them. It is also when we explore our interest to decide which specialty that we personally want to go in. So altogether all of that takes about 5.5 years. From the beginning itself, the milestones are set, our path is set, we know what we have to do next. And I don't mean to say that it's easy or it is even straightforward, because everybody has a different path. Some people decide to go for a job after internship, and some people like to completely focus on preparing for PG. I took 2 years time after my internship. So 1 year I was completely focused on working, getting experience, exploring my interest, and another year I just sat and studied. So I've done it both. And while that was a very confusing and uncertain period, it was also a period of a lot of growth. After finishing your MD or your training, uh, I don't have a path set for me, right? So now the ball is in my court. I have the flexibility and the freedom to decide what I want to do, what jobs I want to take, and that can be overwhelming in a whole different sort of. So that has been really unsettling and uncomfortable feeling because I'm doing all of this for the first time. And doing it as a specialist is a whole another ball game. Nobody teaches us all these things now in college, how to kind of negotiate for what you deserve, and how to find basically the right fit for you, the right environment for you to grow professionally. So I guess I just wanted to share that. And if you're also in a similar situation, I think the best thing to do is to spend a lot of time with yourself and ask yourself some of the important questions, like, where do you see yourself in 5 years, and what kind of work environment that you want for yourself. I think that will really help. That's what I've been doing, and that's what is been there in my mind. Something that I wanted to share, and hopefully be able to remind you that feeling uncomfortable or unsettled is not always a bad thing. So now coming to one of the very important questions that I get asked a lot, especially on Instagram. A lot of medical students, they are reaching out to me, and I feel extremely happy because they're considering pathology and they want to know whether it's a right branch for them or not. So I'll tell you how I kind of concluded that I like it. So I always liked the subject. When I was in medical college, pathology was actually the first subject that made sense to me. I thought like it's really logical, and if you know the normal, you can definitely differentiate it from what's abnormal. And you have to know that what you learn and study in medical college is barely scratching the surface, and we don't really have much exposure of the lab life during MBBS. And I think that's one of the main reason why people are not proactively, taking up this branch. Although that's also changing nowadays, the trend is shifting and people are more interested in diagnostics than before. Um, so for me, I always liked the subject. Then, like I told you, I worked in emergency medicine for almost 10 months after my internship. And that's when, I realized that that's not for me. Plus, I missed the continuity of care. I like to get the bottom of it all. Like, I didn't like the feeling of not knowing what happened to that patient once they were shifted from emergency. So, and then I had a little bit experience working in respiratory medicine, and I had a wonderful mentor there. During that time period that I actually came in contact with a lot of pathologists, and I understood the importance of diagnostic. I really loved, how quickly patient responded to medicine once the correct diagnosis was made. And so it really inspired me to, pursue this branch, because I loved that feeling that, your decision can change the course of patient's illness forever, and that's just a very wonderful feeling. Apart from that, obviously, I liked a little bit of everything. So, pathology is very diverse, you never know what to expect under the microscope. Uh, One day you are looking into uh, endometrium, and then the next day you have a brain tissue under the microscope. So, that is very interesting to me. So yeah, those were my reasons for taking up pathology. So another thing is that pathology is very specific science, right? There is no shooting in the blind. You see the cell exactly for what it is. Pathology is a very academic branch. You have to study a lot, and I like studying, but I didn't know that there will be so much to study, because you have to know everything about everything. It's not like you're specializing in just one organ, so you can diagnose that particular organ. Of course, when you're doing uh, fellowship or anything, you can choose to subspecialize in particular branch. But as a comprehensive pathologist, when you are in training, you get to see everything, and you have to know everything about everything. um, and which is why it also offers a lot of research possibility. So that's another reason that I really liked it. I think those are my probably the topmost reasons why I chose pathology. If any of this kind of resonates with you, then you can definitely consider this. But one thing that I would urge you to look into is whether you're okay not having to interact with patient, because I know that can be a huge thing for some people. And we do interact with patient when we are doing procedures like FNAC and stuff, but it's not like treating them. So if that's a deal breaker for you, then pathology is really not a branch for you, and you need to kind of consider that before taking a pathology. So don't take it as a compromise, because it's a beautiful branch, and it deserves for you to give your 100% uh, to it if you want to become an excellent diagnostician. Otherwise, it wouldn't be fair to you or to your patients. So yeah, those were my reason for taking up pathology. I hope it resonates with you and help you decide, because I know the NEET PG counseling is around the corner, and you may be wondering, which branch to choose from. So I hope that this video gives you that nudge to make a decision. And yeah, I'll see you all soon with the next video. Bye bye.